talking about ADHD coaching. We'll start, that's okay, come on in. We'll start by giving you just a brief introduction about coaching. Coaching can vary a lot. There's no one way of doing it, basically. So we're going to kind of tell you in general what coaching is about. Then Jennifer is going to discuss a short-term coaching intervention that she actually does with students. It's a little different than what I do. Then I'm going to give you an overview of, we're calling it long-term coaching just so we can kind of compare the two. But what we do, because we're all mental health practitioners at Psych Ed coaches, is we kind of integrate therapeutic approaches as well. And then lastly, I'm going to give you some evidence about why ADHD coaching is helpful and evidence for its utility. And this is going to be based on kind of the other research that we do have, which there's not a ton of, and then my own doctoral dissertation study, which was done to kind of help provide evidence for its utility. Okay, so ADHD coaching is just one of the many coaching models we have now. When you think of coaching, you typically think of athletic coaching, and that's where this all derives from. So you think of someone who kind of supports and trains you to utilize your skills in the best way possible so that you can succeed. And in the 80s, it kind of took off and went 100 different directions. And today now we have not only life skills coaches, we have financial coaches, we have fashion coaches, we have pretty much every kind of coach that can possibly exist. And so it's not, it kind of happened really fast, and it's not a highly regulated profession. So one of my disclaimers is, if you are out there looking for a coach, make sure you check their background and you check if they have a certain kind of degree, because it can be anyone from someone who, maybe a mother who had a child with ADHD, and so they feel like they have a lot of knowledge and want to help, all the way to, again, the doctoral level. So just check your background, make sure you know what you're getting into. And basically, it involves helping clients deal with aspects of their disability. This is ADHD coaching specifically. Mostly we're focusing on academic, work performance, social encounters, and what we call life skills. Those are things like even doing your finances, getting to bed on time, getting your laundry done, getting your chores done, all that kind of stuff. So some of the specific life difficulties that may lead one to coaching in general are the following. Procrastination, lack of concentration or focus, lack of motivation, poor self-regulation, poor planning, anxiety, social problems, and poor time management. So as you can see, a lot of these are kind of the basics of what ADHD is, or kind of executive functioning deficits, we call them. In my practice, we don't require diagnosis. So you might be able to say, well, someone suffering from depression or anxiety or bipolar even has these things, and that's true. So coaching, even though we call it ADHD coaching, doesn't necessarily mean that ADHD is the only type of person that it can help.
Did you say you see both children and adults, or?
We do. We see children, adolescents, and adults. Yep. And I'll just tell you right now, I think we ran out of the PowerPoint, but you all know that you can get it. And then there's also a flyer out there that kind of explains our services. So some of the strategies that a coach may help a client with are things like organizational skills, time management, goal setting, study skills, prioritization, relaxation techniques even, and again, the financial planning. So again, like I said, this can be ADHD and executive functioning, or it can be other people suffering from different disorders who just struggle with those same issues. So one of the ways to explain ADHD coaching is kind of to explain what it's not and how it's different from, say, therapy. So that's the question that a lot of people ask. So the next couple of slides, I'm going to kind of talk about that and help you distinguish exactly what it is and how it's different. So the similarities are basically that they're both helping environments. They're both supportive and they're respectful of the client. They should be confidential, free of manipulation or abuse. Work on setting goals. Now, certain types of therapy, and I'll talk about this more, can be more goal specific than others. So it also kind of depends on what type of therapy or counseling you're doing. And then requiring a client who is willing to elicit change. That is a very important statement, especially when it comes to, say, teenagers. We often get teenagers in there because mom and dad wanted some there. Now, that can be okay to start. There's not too many teenagers that say, Mom, go get me a coach. So sometimes they'll come in, and not really want to be there, and that's fine. But really, they need to start to take some accountability and take some independence, and that's really what the coaching process is about when it comes to the younger students. It's kind of, mom and dad are usually doing a lot of work. They're helping with the homework, they're checking Blackboard every night, and so we really want to change that. So if you get a really highly resistant client who just doesn't want to be there, it's not really, going to be effective.